The Ministry of Health and Wellness is implementing its COVID-19 surge plan. This as the country's hospitals have run out of bed space in the wards dedicated to treating COVID-19 patients. Minister of Health and Wellness, Dr. Christopher Tufton, says additional bed spaces are being created to offset the shortage. There has been a steady rise in the number of new COVID-19 cases in the last few weeks. More than 400 new cases were recorded over the last 48 hours. The Health Minister, Dr. Christopher Tufton, says the increase in COVID-19 cases have led to more hospitalizations.
We now average some 48 admissions per day across all our hospitals. Based on the epidemiological data, we're averaging an infection rate, or R0 rate, as said earlier, of 1.3, which means that every person infected with COVID-19 will infect approximately 1.3 others. If this rate is not reduced, we will continue to see a rise in infections, which will ultimately lead to an increase in the number of persons that are hospitalized.
Dr. Tufton says as at February 26, all beds currently dedicated to COVID-19 isolation are now full, and the Health Ministry's surge plan has been activated.
In implementing the plan, the following actions are being taken. St. Joseph's COVID-19 ward at St. Joseph's Hospital, this is a 36-bed facility, is now in operation with an occupancy of approximately 8 persons. As the weeks move on, we will admit more patients to this ward based, of course, on the infection rate. Falmouth Hospital COVID-19 ward, this 36-bed facility is now fully equipped. While the building is complete, the appropriate infection prevention and control measures must be completed before the building is safe, especially for patients with severe acute respiratory illness.
Dr. Tufton says the Spanish Town Hospital has added 40 beds with the use of the field hospital erected on its grounds.
And at the University Hospital of the West Indies, there's some conversion taking place from regular wards to COVID wards. The management of the UHWI has now completed the conversion of an additional ward for the admission of COVID patients, numbering some 24 beds. In terms of overflow wards, or a partnership, public-private sector partnership with the Andrews Memorial Hospital, we want to express our thanks to that institution for the 15-bed non-COVID facility that is established at that location, which will take some of the pressures off the regular hospital system in the corporate area so that we can dedicate more time to COVID support should we need it.
On the matter of personnel,
so we have increased hiring of staff in the Southeast Regional Health Authority and the Western Regional Health Authority, which have the main Type A hospitals. In the Western Regional Health Authority, which consists of St. James, Trelawney, Hanover, and Westmoreland, 18 additional temporary doctors have been approved, with 6 receiving contracts to start tomorrow morning. 42 nurses, assistant nurses, and patient care assistants are being hired, with some 14 being interviewed tomorrow, Monday, March 1st. In the Southeast Regional Health Authority, that consists of Kingston, St. Andrew, St. Thomas, and St. Catherine, 43 additional temporary doctors have been approved, with 4 receiving contracts to start tomorrow, and 236 nurses, assistant nurses, and patient care assistants are being hired, with contracts being finalized for deployment within the next 2 weeks.
Prime Minister Andrew Holness, in addressing the matter, urged Jamaicans to be vigilant.
If you have to go out on the buses, in the market, walking on the road, try to avoid a crowd. If you are going anywhere and you see more than 10 persons, as I like to say, take care of yourself.